Often when we think about suicide, we think about the ways in which individuals' self-continuity gets sort of disjointed from their cultural continuity. And so as tribal people, we often understand ourselves as part of a collective, but much of the language about suicide is very individual. And so one of the things that we've tried to do is to really push back against some of that, it's you're in a black box, this is an individual choice. It's not an individual choice. It's a choice that you make that impacts the entire community, changing that connection, but also recognizing the ways in which the systemic discrimination against Native people in schools and in other spaces where kids don't get to learn about their future self and don't get to learn about who they are as contemporary people, we are creating that disjointedness. And so a big part of what we have to do is really get America to stand up and want to see us as contemporary people, to allow us to redefine ourselves, to allow us to have a voice in who we are, and to not continue this frozen in time, vanishing Indian rhetoric, because it's not true. I mean, when you look at under age 25, Natives are growing at a higher rate than any other group in America. And so, we are here and we are functioning, but also to clinicians, as we think about psychologists and how we get the news out there, you can't come to Indian country and talk about suicide as an individual choice because you make us feel more alone. And so some of it is, whose responsibility is it? To my own field. I mean, we've been trying to call out, if you look at the 40,000 papers on discrimination, less than 0.5% even mention Natives. Mm-hmm. And 0.1% actually have Natives in some substantial way. So we're a much higher part of the population, but we're not being studied. And people are not using science to help our communities.